we'll get started. This is super exciting. Thank you so much. Cool. Hello, everybody. My name is Jonavi Rao. I am the president and founder of New Voters, a student-led nonprofit that registered 50,000 high schoolers to vote for the 2020 election. As part of our mission to increase youth civic engagement, New Voters has launched the Teens Get the Vaccine campaign to get every high schooler in America vaccinated. We are so excited to have you all here today to hear Dr. Tom Frieden respond to youth vaccine concerns.
Great to be with you.
Thank you so much. Thank you so much for being here. I have a quick bio for you, just so everyone, your name definitely precedes you, but Dr. Frieden is a physician trained in internal medicine, infectious diseases, public health, and epidemiology. He is the former director of the U.S. Centers for Disease Control and Prevention and former commissioner of the New York City Health Department. Dr. Frieden is currently president and CEO of Resolve to Save Lives, an initiative of the global health organization Vital Strategies. His work made New York City's tuberculosis control program and overall health department models for the world, established effective programs in India, and improved morale, effectiveness, and impact at the Center for Disease Control and Prevention. Dr. Tom Frieden's influential publications have identified the what, how, and why of action to improve health. We are so honored and excited to have you here.
It's my pleasure. I'm looking forward to the conversation.
Thank you so much. So first off, just jumping into it, we have a question from our Director of Communications at New Voters. Abby, take it away.
Hi, my name is Abby Fallon. I'm a junior in high school in Miami, Florida. Through running a New Voters vaccine hesitancy drive at my high school, I've heard a lot of my classmates say they're not getting the vaccine because they feel the trial was rushed and are concerned about the long-term effects, for example, on their fertility. So how do you recommend we respond to these concerns?
Well, first, let's have an understanding of the vaccine being rushed. It was not rushed. It was fast, but not rushed. They were corners were not cut. Red tape was cut. So what you had is a vaccine that's actually been under development for more than 20 years. Since before you were born, they've been working on this vaccine. And fortunately, it works really well against COVID. So the first thing to understand is the vaccine is highly effective and quite safe. I've gotten it. My kids are getting it. I want to encourage everyone to get vaccinated. The vaccine is much safer than getting the virus. If you get the vaccine, what the mRNA or Pfizer and Moderna technologies do is basically teaches your immune system to recognize the virus, like a most wanted picture, teaches it to kill the virus without you having to go through the trouble of getting infected by the virus, and then it disappears like a Snapchat message. Now, interestingly, in contrast, if you get the virus, it's going to be in your body for a week to 10 days. They're going to be billions of copies. And although not common, some kids get very, very sick from it. There's something called a inflammatory condition that can occur days to weeks later. Kids can be hospitalized. Some kids have died from it. So although it's certainly true that the virus makes older people much sicker than younger people, it can even make young people sick. Now, the second question really you asked was, what about long-term side effects? Might there be some long-term side effects of this vaccine because it's a new vaccine? Well, the way the vaccine works is basically teaches your body to make antibodies against the virus. That's the same thing that'll happen if you get the virus itself, except if you get the virus itself, you might get very sick from it. So it essentially saves your body the trouble of getting the virus, gives you the vaccine. And if you look at all of the vaccines we have, we've not seen any long-term negative consequences like that. The vaccine is gone from your body after it's taught your body how to fight the virus well.
Thank you so much for your response, Dr. Frieden. I have actually gotten my first and second dose, so I'm really excited about that.
Great. Thank you and congratulations.
Thank you so much, Dr. Frieden. Yeah, Abby was actually has been a huge proponent of getting the vaccine at her school. She's going to be soon going to every single classroom at her high school and giving presentations, hopefully on getting the vaccine, which is super exciting. So go, Abby. And next up, we have a question from a member of the New Voters Policy Team. Dania, if you want to get started.
Thank you so much. Yeah, and I'm super excited to be here today. Hello, Dr. Frieden. My name is Dania Smith. I'm 16, and I lead a New Voters chapter at my high school in New Jersey. And my question is, as of May 3rd, only 13.9% of people who have received one dose of the vaccine are known to be respectively Hispanic or Black. From the Tuskegee experiments to the economic and cultural inequities in the U.S. healthcare system that disproportionately harm Black and Latino communities, there are various reasons as to why some may look askance with fear at the COVID-19 vaccine. So my question for you is, in your opinion, what is the most efficacious way to encourage and aid Black and Brown communities in receiving the COVID-19 vaccine, especially given the injustices throughout America's medical system?
Well, first off, I think we have to recognize those historical injustices and be frank about them, because they have been horrific and they are continuing. We continue to see injustice in health as well as in healthcare. And one thing that we're seeing over the past few months in the US is an increasing interest and willingness of Black and Latinx people to get vaccinated. But I would make an important observation here, which is that the biggest problem about low vaccination rates in the Black and Latinx community is not reluctance, it's access. If you look at a poll done by the Kaiser Family Foundation, a much higher proportion of white people who want to get vaccinated have gotten vaccinated than Black or Latinx people. So we have to make access more. And access means easy, walk in, no appointment, hours, early and late. So if people want to get vaccinated before or after work or on weekends, they can. So one thing that has to be solved is the access problem. Next is the right messages and the right messengers, because there is some reluctance or concern, some of them because of the historical experience. You have some great role models out there. Dr. Corbett from the NIH, a young African-American doctor, is one of the people who created the Moderna vaccine, and she's been out on social media. So that's an important role model. Working with community leaders, whether it's religious leaders, scientific leaders, political leaders, cultural leaders, to get vaccinated. And then the messages, making sure that the messages resonate with people, because it's going to be different messages that work for different people. And whether it's the Black community, the Latinx community, or there's been a lot of focus on people who voted for Trump and are very reluctant to get vaccinated. Everyone needs a few things. One, to be listened to respectfully. Two, to have their concerns validated, that yes, we understand that's a concern. Three, to have their concerns answered with the facts, actual data. And I would say four, also to hear the stories of the terrible suffering that COVID has caused and continues to cause, and of the freedom that getting vaccinated is going to bring.
Thank you so much, Dr. Frieden. That was a phenomenal answer, and I'm really glad that was answered.
Thank you. Thanks for your question. And thanks for the work that all of you do.
Thank you, Dr. Frieden. Dania, that was really great. When we first read your submission to now, you're so insightful. And thank you, Dr. Frieden, for that. It's super interesting, especially about the freedom after the vaccine. I feel like that is definitely something that people are honing in on a lot when talking about, why you should get the vaccine. But it's also super interesting because my friend in Colorado just told me that he was getting his second dose at a Walgreens, and the person who was getting the vaccine, someone else who was just in the Walgreens, asked the person administering, "Oh, you are all vaccinated. Why are you wearing masks?" And the person, giving the vaccine was kind of like, "Oh, we can still, transmit it. Like, it's still not safe for us to not wear the mask." And my friend, who is, very pro-vaccine, is saying, "Oh, we should have people who are like fully vaccinated not wear their mask as often as possible to show vaccine hesitant people that, this is the life that's waiting for you." What are your thoughts on that? This is a segue from the questions before, but
it's a tricky one. That's a tricky one because if people aren't wearing a mask, how do you know if they're vaccinated or not? So one thing is that how well your vaccine protects you also depends on the people around you. The more people who are vaccinated, the safer all of us are. And the lower the rate of COVID, the safer all of us are. No vaccine is 100%. There are a few breakthrough infections, but you're way less likely to get COVID or spread COVID if you've been vaccinated. What we hope will happen is that over the coming months, enough people will be vaccinated and will be careful enough about masking and other measures, so cases will come way, way down. And then it's really a question of finding cases before they become clusters, finding clusters before they become outbreaks, and continuing to vaccinate and thinking about the rest of the world. Because as long as the pandemic is spreading all over the world, there could be even more dangerous variants emerging that we have to fight. But fundamentally, we've already said, if you're vaccinated, don't have to wear a mask outdoors. I think you'll see more and more of that as cases come down, and they're coming down very nicely in the US. We can do more and more. The sooner we vaccinate, the more we can do.
Thank you so much. No, that's really helpful. I will send this clip right to my friend so that he has that answer from your mouth. Thank you so much. Next up, we have a question submitted by Milo Chang, who is 18 and from California, read by a member of our policy department.
Yes, thank you. Hello, Dr. Frieden. My name is Sefkhan, and I'm a junior in high school in the Atlanta area. So Milo's question is, with the Pfizer vaccine now being approved for those age 12 and up, do you have any suggestions for how high school students can have conversations with vaccine hesitant parents who don't want their children to get vaccinated?
That's a great question. I think the more you make clear that I don't want to get sick, I don't want to make you sick, I don't want to make other people sick, I don't want to have to worry about COVID. If you can get me vaccinated, it'll be one less thing for me to worry about. I care about you. I'm getting vaccinated for myself and for you. And even if it's true that as a kid, you're not highly likely to get very sick, you could spread it to someone who dies from it. The last thing you want is to have for the rest of your life thinking, you know, my grandmother died and I might have given her COVID. You don't want to have to live with that. And I think that's one argument for parents and kids to think about to get vaccinated. I'll tell you a sad story. 90% every year in the US, there are children who die from influenza. And about 90% of those children haven't been vaccinated. And many of them would not have died if they'd gotten vaccinated. So when I was at CDC as the director, there were some very courageous parents who were willing to come forward and tell that story and say, my child died because I didn't get him vaccinated. In this case, it's not only about the child getting very sick, but potentially spreading it to other family members.
Thank you so much for your answer. And I just wanted to mention, I also got my Pfizer vaccine, both of them. So thank you.
Great, well done.
Thank you so much, Dr. Frieden. Yeah, sorry, my Wi-Fi just had a moment there. But no, that's incredibly sad. And we put out a poll on our Instagram asking people, you know, why are you not getting vaccinated, or why have you heard other people not getting vaccinated? And one was like, I didn't get the flu vaccine, so I'm not going to get this vaccine. And it's clearly, you know, an epidemic in many ways, which is very sad. But next up, we have a question from a member of our operations department, Oriana.
Hi, my name is Rhianna. I'm a senior in high school in Pennsylvania, but I'll be attending Stanford University in California in the fall. And my question is more not just addressing parents, but addressing students. How do we emphasize the value of getting vaccinated to our peers when they feel they don't need to due to like low hospitalization and death rates, and they don't use that as a reason to fear COVID?
I think you have to emphasize your impact on others. You're going to go into a supermarket and pick up some food. That checkout person is working and maybe living with a couple of generations. And you may not ever know that you had COVID. Up to half of people don't have any symptoms. So you really wouldn't kind of throw a brick out of window because you hope it doesn't hit someone. In the same way, you wouldn't risk spreading an infection that you can't know that you have, that ends up killing someone. I think that's a strong argument, but also it's not so minor. Yes, people generally do fine, but there are people who've lost their sense of taste and smell for a long time. It's very unpleasant. There are people who've gotten quite sick from it. So although most kids do just fine with it, who wants to be sick?
Thank you so much. And just to follow along with the trend, I'm getting my second dose next week.
Great. Wonderful. Well done.
Thank you so much. And Oriana had her prom last night and it was super well done. I think, masked, distanced, outdoors. So that's
Triple tested.
Oh, that's awesome. Well, thank you so much, Dr. Frieden, for spending time with us today on this critical topic and helping clear up so many concerns. Your organization resolved to save lives with its goal to save 100 million lives all over the world. Sounds amazing. Could you tell us a little about the overall mission of your incredible organization and how the youth and new voters may be able to help?
Well, thanks. We have two goals at Resolve. One is to partner with countries around the world to prevent 100 million deaths from heart attacks and strokes. And the second is to help countries be safer from epidemics and pandemics in the future. And I think one thing to understand is that we are all connected globally. Martin Luther King Jr. said, injustice anywhere is a threat to justice everywhere. And in the same vein, ill health anywhere is a threat to health everywhere. If we look around the world, certain countries, in Scandinavia in particular, provide a lot of support for global health, way out of proportion to their population or income. And they do that because for many years, kids, high school kids, college kids, have engaged with the world, have understood what's really happening with global health worldwide, and have said, we want to be part of the solution here. And so one thing we hope is that throughout the US and throughout the world, there will be an understanding that we are all connected. And the more we support health progress in other countries, the better off all of us will be.
Thank you so much, Dr. Frieden. No, I definitely, our theory of change is 100%, young people can create movements, can create change, and are doing it every day. And I definitely think that we can also lead the way in terms of public health crises. If you have a few moments, we asked people on our Instagram why they or their friends weren't getting vaccinated. And I have some rapid fire concerns from them.
Okay, let's do it.
Respond to them. So first up, what's the point of getting the vaccine when you have to wear a mask anyway?
You won't have to wear a mask much longer. You don't have to wear a mask now outside. And when levels come down more, when more of us get vaccinated, we can throw away those masks in most situations.
Awesome. I want to wait until more time or tests have passed before I get the vaccine.
More than 150 million people have gotten the vaccine. Nobody's died from it. And hundreds of thousands of people's lives have been saved by vaccination globally.
I've already had COVID and have antibodies, so I don't need it.
COVID does give you some immunity, but the vaccine immunity is even stronger. If you so do get vaccinated, even if you've gotten COVID, because the immunity is stronger and lasts longer.
I'm only going to get one dose because I know many people who got bad side effects on the second dose.
If you're over 18, you can get one dose of the J&J vaccine, and that's enough. If you're not over 18, unfortunately, the only vaccine that's approved now is the Pfizer vaccine. Pfizer or Moderna for the Pfizer vaccine. So you'll have to get 2 doses. What's pretty clear is that a single dose is much less protective than 2 doses.
And then we had some random questions about microchips and that, which, but the overall, this was really fantastic. Thank you so much, Dr. Frieden. I personally have a question. So I just came back from my junior year at Harvard, and people were going a little insane at the end of the year. There were, live streams of the final clubs being overrun with people. But the rationale was oh, we're all outside. Many people are vaccinated. However, in Massachusetts, you would be getting your second dose this week. So when communicating with people who constantly justify their unsafe COVID actions, do you have any advice?
I just hope we can hang on a little longer, because vaccination is increasing, cases are decreasing. By the summer, the situation will be much better, and in the fall, we'll be at the new normal. Until then, vaccinate, and when you're indoors with a bunch of other people, please do continue to wear a mask.
Absolutely. Thank you so much. And to close us out, I'll pass it to Abby, who has a question. But thank you so much, Dr. Frieden, for being here. Anyone who's interested in running a vaccine hesitancy campaign at their high school with a personal mentor, Please check out our website, new-voters.org/vaccination, and you will get a personal mentor and a day-by-day instructions to running a vaccine hesitancy drive at your high school. So Abby, if you want to close this out.
So my question is, because there's such a debate about this, what do you think about having both colleges and high schools require the vaccine to go back to school? Because I know public schools, there's a lot of red tape there. So, and specifically in my state, it's a little bit more difficult to have that legislation. So what is your opinion on having schools require their students have the vaccine to go back?
That's a tough one, Abby. I don't know the right answer. I think each school is going to have to decide that for themselves. There are some colleges that have decided to mandate vaccination, and I think that's very reasonable because you've got kids living in a dorm together. They're getting taught by teachers. Some of those teachers are not real young, and older people are really susceptible. So if you want to get to a new normal, you need to get as many people as possible vaccinated. It is important that there be exceptions for people who have a true reason not to get vaccinated, not because they don't feel like it, but a true medical contraindication to vaccination. They're very rare, but they may exist. So you have to have some individualized attempt to or opportunity to not be vaccinated. But I think that's a decision for different institutions to make. Unfortunately, vaccination as masks has gotten made political in a way it didn't need to be. This is a health issue. And unfortunately, politics seems to have gotten into too much in our lives. There's very important roles for politics, but it shouldn't be getting in the way of us and scientific advances.
Thank you so much, Dr. Frieden. Oh, I just said it at the exact same time as Abby, but thank you for being here. This was really incredible. Everyone, you can unmute and say your thank yous as well. But we don't want to keep
Thank you.
Thanks to
Thank you
all
so
of you.
much.
Thanks for
Thank you so
what you do. Very important.